Obstetric fistula is a medical disorder when delivery causes a hole to form in the vaginal canal. This may occur between the bladder, vagina, or rectum. It may cause feces or urinary leakage. Vesicovaginal fistulas, in which a hole develops between your bladder and vagina, are the most typical kind. Gas and feces may flow out of the vagina as a result of the condition. You might experience physical discomfort as well as mental suffering as a result, which might affect your interactions and self-confidence. 10 warning signs of obstetric fistula after childbirth. 1. Urinary leakage. For so many people, the feeling of uncontrollably spilling pee can be humiliating. Some women experience urinary incontinence, which is a lack of bladder control, after giving birth. Urethra and bladder, which usually regulate the flow of urine, can be affected by fistulas, which can result in extremely severe urinary incontinence. They may cause urine leakage. 2. Abdominal discomfort. There are several reasons for abdominal discomfort. Digested food cannot pass through the body normally when a person has a gastrointestinal fistula. Moreover, the fistula leads to fluid leakage, which can cause abdominal discomfort. 3. Foul-smelling vagina discharge. A fistula may occasionally cause an unpleasant odor. This symptom can be distressing and upsetting. Urine can most likely leak out of your vagina if you have a vaginal fistula that opens into the urinary system. Most likely you may experience foul-smelling fluid or air coming from your vagina if you have an obstetric fistula that opens to your colon. 4. Anal incontinence. When bowel motions cannot be controlled, the condition is known as fecal incontinence. Gas or feces may enter into the vagina as a result of bowel contents leaking through the fistula. 5. Vagina bleeding. It can be used to describe menstrual bleeding or bleeding from other health conditions. Vaginal bleeding often refers to bleeding that is unrelated to a menstrual cycle. Due to the extended labor, fistulas might lead to vaginal bleeding. These holes develop as a result of dead vaginal tissue, forming a gap between your vagina and other organs either in the digestive or urinary systems. 6. Rectal bleeding. Foul-smelling vaginal secretions, dyspareunia, releasing gas, bleeding, and passage of stool is caused by the leakage of poo or gas from the rectum to the vagina through the fistula, particularly when the person has dysentery. 7. Pain during sexual intercourse. Fistulas are irregular, penetrating passageways that often extend from the rectum to the anus. A hole between the rectum and vagina, known as rectovaginal fistulas, can cause a person to release rotten-smelling gas, feces, or discharge. Furthermore, you can run a risk of getting an infection or irritation in the genital region, which might make sexual activity painful. 8. Smelly urine. Persistent urine leakage may result from genitourinary vaginal fistulas that develop between your vagina and the urinary system. Your vagina can probably release gas or a persistent smell urine odor. 9. Urinary tract infections, UTI. The flow of bowel fluids via the vagina is the most typical symptom of a rectovaginal fistula. It may also result in bladder infection, which leads to excessive and occasionally painful urination, or swelling of the vagina, which causes blistering, burning, and itchiness. 10. Skin itchiness in your vagina. The pee from your bladder will continuously flow into your vagina if you have a vesicovaginal fistula. You might find yourself unable to restrain your urination. Moreover, you can get an infection or a rash in your vaginal area, which can make you feel vaginal discomfort. The tissues in the vagina die when there is insufficient blood flow. When this occurs, the tissue develops an opening. These openings may form quickly or gradually for years. Some of the causes of obstetric fistula include protracted delivery labor, vaginal tears after delivery, pelvic or abdominal operation, bowel inflammation conditions, infections of the colon such as diverticulitis, radiation treatment for the pelvic area. Most vaginal fistula patients require surgery. Fistulas are more likely to occur in women who have long labors or have pelvic surgeries. Women who reside in areas with a shortage of medical services are more likely to experience this condition. Some women might take even days before they deliver. A fistula can form when the baby presses against the vaginal canal, blocking off the blood circulation to the tissue. Well, Are you experiencing signs of fistula, and are you embarrassed to speak up? Now is the time to visit your doctor for further medical examination. Let's fight fistula together for a healthy living. See you in our next video for more educational tips. Remember to like, share and subscribe to our daily posts and videos. Thank you for watching.